The turn of the new year can provide just enough encouragement to make some drastic life changes, and some of us could use improved vision. May Eye Care Center is the perfect place to give your future a better view. Dr. Carl May Jr. is here to discuss LASIK surgery, and I'm so happy you're here because I want to know all about this. Tell me first, what are some reasons that people do opt to go the LASIK surgery route?
There would be two main reasons why people have LASIK. One is cosmetic. They just don't want to be seen with glasses on. But mostly it's for convenience. They're sick of putting their contacts in and out, going on vacation and losing a contact or glasses. We get that all the time. Patients say they lost their glasses and couldn't find any place where they could get it filled while they were away.
Oh, it is. I mean, I'm one of these people. It's very annoying. Your contacts are ripping. They're ripping when you're driving. This has happened to me, so I'm very interested in LASIK. And something we were chatting about before the show, which I didn't know, there are different types of LASIK procedures.
The LASIK procedure itself is where we make a flap on the surface of the eye, and then we sort of carve your contact lens prescription right on the surface of your eye. Ooh. We put the flap back down, and then it's like nothing happened. You can start seeing right away after we're done. The other main procedure is called AST, where we carve the prescription right on the surface of the eye without making that flap.
Oh, that's so interesting.
It takes much longer to heal, but then you don't have to have a flap made.
That sounds so interesting. I love this. How do you know then which one is the right one for you?
The one without the flap is usually for people that are in contact sports or in a profession where they might get hit in the eye, firemen, policemen, things of that nature, where if you got hit hard enough, it could actually move the flap after it was made.
Oh, wow. But of course, then you'll evaluate the patient, and then you can help recommend which one would be better. And you mentioned firemen, policemen. You have performed LASIK for many of those first responders. Also some people in the know, I mean, some famous people. Tell me about that.
Yeah, I've been doing LASIK for a long time, more than 15 years. Even before it was approved, I was doing it in training. And that allowed me to build a reputation and a name in the area where a lot of sports figures come to May Eye Care. And then recently we ran a contest for people in the military where they wrote a story about why they would want to have LASIK, and then we had people vote online for the person they thought deserved to have LASIK, and we gave that away.
That is so cool. What a nice way to give back to the community. Something I've kind of always wondered, is it worth the expense, or is it worth the investment compared to maybe just wearing contacts and glasses for the rest of my life? What would you say?
I would say yes. In addition to the convenience factor, over time it definitely pays for itself because you no longer have to buy solutions, contacts, go back to get your eyes re-examined for the contacts. So in the long run, it does pay for itself.
It does seem like such a great option. Where are you located? How can we get in touch with you?
We are in Hanover, Pennsylvania. The best way to find us is to go to mayeyecare.com, and we have information about our phone number. We can schedule a free consult and link to a map that'll show you right where we are.
I know, and I just want to say again, your name really is linked to LASIK surgery in this area, so definitely a great place to go for a consultation and to see if this is the right thing for them.
Okay.
Thank you, Dr. May.
Thank you.
Thank you.